Hi, my name is Braden Wolmer. I am going to present to you about elimination disorder, about what it is and how we can intervene at school. I chose this as the disorder I wanted to take a look at because I really didn't know much. I saw it on the list, I read a little bit about it, and I thought that if I would truly want this to be the greatest learning experience, this is where I could start. So with elimination disorder, I found that there are a few different pieces to it. Most times we're talking about enuresis or encopresis, and some research does include toilet refusal as well. So I'll start with enuresis. Enuresis is what we would consider to be the most typical. This is usually happening at night. There is nocturnal enuresis and diurnal enuresis. Most of the time it is happening in bed. It's bedwetting. Enuresis is pretty prevalent worldwide. 10% of 7-year-olds or around that age range do suffer from nocturnal enuresis. So what does define this, or what categorizes someone as having this? Repeated urination in bed or clothing, at least 2 occurrences per week for at least 3 months, or a sufficient amount of occurrences, chronological age of 5 or higher, or a developmental age, a developmental range of that age. And then not due exclusively to substances or a general medical condition. If it's not medically connected, it is considered enuresis. Encopresis is defined as soiling from 4 years or higher. 1 to 3% of children worldwide suffer from this. What categorizes someone as having this? Repeated passage of feces in inappropriate places, whether voluntary or intentional, unintentional. At least one event a month for at least 3 months. Chronological age of 4 or equivalent developmentally. And the behavior is not, again, due to any physiological effects of substance or a general medical condition. Toilet refusal is a bit different in that it is functional encopresis. It is seemingly potentially more choice. Maybe there was a bad experience on a toilet. Maybe last time a child went, it really hurt. They couldn't go. They got yelled at, something like that. What makes this functional is that they could request a diaper. They could request something in order to use the bathroom. So it's truly just refusal of using a toilet. Both enuresis and encopresis do decrease over late childhood and adolescence. And I will say this, it seems like for all the information we have, there isn't enough information. That this seemingly, fingers crossed, goes away. All right, so the significance of all of this. In the research that I read from Brown, in the past, this was perceived, encopresis and enuresis, both elimination disorders, were perceived as acts occurring and based on character. So the punishment would be punitive. You would get in trouble for doing these things. Even mid-century, as it started shifting to being more understanding that there could be like psychodynamics or something going on in the home, or even, connection. We'll see on the next slide that enuresis does run in families. There's a higher prevalence of children wetting the bed if it has run in the family. There is a shift away, but there's still this stigma that it's a bad thing, you're lazy, or something along those lines. Still somewhat behavioral punishment. And now we are understanding more that there are psychological disorders that make it more frequent for children to have enuresis or encopresis. And it is a high burden for these little kids. They internalize and externalize behaviors, um, based on some of these things. Some facts: 20 to 30% of children with enuresis, um, and 30 to 50% of children with encopresis also have comorbid disorders, um, and are 4 times higher, which is 4 times higher compared to healthy peers. Um, the two highest disorders that are comorbid with this: ADHD and oppositional defiant disorder, which again kind of goes to the whole behavioral piece. But I found my research to be very cyclical and all of it tied together. What came first? Um, or is it all just simultaneous kind of thing? So I titled this Symptoms and or Causes, because again, some of these things we can see as potential causes and some of it are potential symptoms, like constipation. Is constipation causing encopresis, or is it a symptom of it? And we'll see with a couple others it falls that way. Sometimes it's excessive parent-child conflict that is causing some of these issues, some of this refusal, or even involuntary. Irrational fears and anxiety, again, it could have potentially been a poor experience before that is leading to more experiences. Difficult temperament, decreased motility, less movement, um, less bowel movement, less. I don't know if anyone has had surgery or anything, or been very ill and you have to lay down for quite some time, but it causes problems. A bland diet, low liquid intake or high liquid intake, medications, family history. Again, enuresis is connected to family history, poor sleep dynamics, and then also infection, and unfortunately also sexual abuse. This sexual abuse is clearly not a symptom, it would be a cause. So when it comes to treatments, it's very interesting because, like I said, sometimes, in some of the research that I did, it goes away over time. Just be kind, just be understanding. Um, just know that this may happen, kind of thing. But above all, especially us as school counselors in buildings, we need to highly recommend medical evaluations. Research is showing stop, get a medical evaluation, because why go through certain therapies, certain trainings, and all of these things when it is a medical issue, and when medically addressed, things will subside, things will get better. So recommending medical evaluation. Connected to this, instructional training, verbal therapy, behavioral treatment. All of these kind of tie together. What I mean by verbal therapy, behavioral treatment, instructional training, timers. Every 2 hours, try to use the bathroom, something along those lines. Praise, things like that are all suggested as actual treatments. But again, above all else, medical evaluation. And that would kind of stem which way therapies or treatments would go. So again, what can we do at school? Number one, recommend a medical evaluation. We're either getting information from parents or we're getting information from the kids or the teachers that there is an issue. Again, most of these concerns are happening, well, enuresis is mostly a nocturnal, but if it is happening at school and is diurnal, we will find out whether, a change of clothes is needed or from the teacher or what have you. We'll find out. Hopefully parents are also keeping us informed. And that's why I also have on here, stay in contact with parents. Once we know, or once students do go through a medical evaluation, parents should be informing us of what is expected on their end, medically, and maybe any treatments that they are finding through their doctors. Share information when approved. When parents are provided some type of treatment. Their child trying to go to the bathroom every 2 hours or having to go to the nurse to take a medication, things like that. We need to share that information, but only what is deemed necessary. Provide comfort and be prepared. We should always have some extra sets of clothing for these kids. We should always have a safe, warm space and try to remove that stigma of this being, a larger issue than it is. It happens. It obviously happens. Might even happen to some of us on the video or anyone listening, to our kids, whoever. But it happens. And I would also say keep a log and stay alert. And what I mean by stay alert is on one of the previous slides, I had shared that this could be a cause of sexual abuse. We need to stay alert in when this is happening. We also need to stay alert in what other behavioral things we are seeing, what our kids are sharing with us for help. If we need to make certain calls, we need to make certain calls. So we just need to be aware of that. Also, a big thing we can do is share resources. So one of the resources that I really enjoyed was this website. Let me make sure it's sharing. From this website, Effective Child Therapy from the Society of Clinical Child and Adolescent Psychology. I really liked this. I feel like it's an all-in-one and is very beneficial and very readable for everyone. So it explains what elimination disorder is. And then it suggests all of these therapies that were tested. So some of the things that I had said, an alarm. At home, there would be dry bed training. Some of these things are definitely at home that we can absolutely support and stay on top of at school. Again, we just need that communication with parent. Lifting, hypnotherapy, again, things that we wouldn't do at school. Different therapies for encopresis as well. There's other places to click as well. It explains a little bit. I found this level 3 one to be interesting, the lifting. Parent lifts or walks the child to the bathroom at night and returns them to their bed. One article suggested that since it's diurnal enuresis, it is a sleep disorder. So I found that to be interesting. Okay, there's also resources, there's videos, parent resources and videos. There's all sorts of things here. So I would direct parents to this beyond the, or anyone that needs to know a bit more, beyond just a medical suggestion. One thing I did want to mention as well is I really found interesting one of the former not therapies, one of the former treatments that they would use was mineral oil and this was for encopresis. So what they would do is provide a large amount of oil to a child to get them to use the bathroom. And slowly over time, they would reduce the amount of oil until bowel movements were regular, and then they would back away from that. So when it comes to some of these things, these aren't things that we would do at school. These aren't things that we would prompt at school. That is a family matter, and that is more medical evaluation. So again, with this one, I can't stress enough that we really steer parents towards that medical support and then back them up with certain therapies, treatments, timers, anything like that that we could possibly do at school. The resources that I used were really fantastic. So they are here in our book by Erfurb. There was a little bit that I used as well. I hope you enjoyed. It's a tough subject, but really good information.